Surabhi, thank you so much for your time this evening speaking to us about community health and about your expertise and experience in the field, particularly of commercial determinants. I wondered whether you might just start by giving us a pen picture of yourself and what has led you to your current role, please.
And thank you so much for that question, Nicola, and the opportunity to speak with you. My name is Surabhi Dogra. I'm from India. I'm an officer of the Emerging Professionals Network of the National Association for Adolescent Health. I'm a part of the Young Professionals editorial group of the UNESCO Chair Global Health and Education. And I have experience of working in low-income communities as rural communities in India. I feel that community health has been the most integral part of my training as a public health professional. As a young person, I feel the experiences that I've had in the community, trying to apply the lessons we learned in the classroom has been the most formative. I feel the members of community have actually shaped my learning far more than what one can experience in just limited classrooms and lectures. So I feel that community health has been the most transformational aspect of my training as a community health professional, as a young professional in India.
That's fantastic to hear. So we came to you because we had heard of your very innovative work around the NCD price tag. And again, in line with our theme of commercial determinants of health, it sits very squarely in our area of interest. And I just wondered if you'd like to tell me about the development of the price tag, how the idea came to be. That would be fantastic.
Thank you so much for that question, Nicola. I think I came up with the idea of the NCD price tag essentially to reflect the price that adolescents and young people have to pay due to the cost of inaction on NCDs. So if I had a NCD price tag, it would probably read name Surabhi, manufactured in a country with the most polluted cities, poor air quality, manufactured in India, handled with care, at risk of NCDs like diabetes, stroke, COPD, cancer, asthma, and the list could go on and on. So I feel that all of us have NCD price tags, and our price tags may have some things in common and it may also have differences. But I can surely say that no two price tags would look the same, even from the same country. So I think back to working with an adolescent girl in rural Maharashtra who lives in a village where the factory next door emits unregulated toxic smoke as she cooks the only meal of the day for her family with wood fire, a deadly combination of hazardous indoor and outdoor air quality in her daily lived life. Their houses don't have regular electricity supply, but the only fridge in the village powers a stock of alcohol and sugar sweetened beverages. But the nearest hospital, the nearest local market with fresh fruits and vegetables is 30 kilometers away, but 1 rupee choco balls and chips packets have made their way to the hands of every child in the village. We are failing to provide basic NCD services at a community level to many adolescents and young people, not only in MICs, but LMICs, but across the world. But the cost of inaction is having to be paid by the millions of young lives cut short by NCD. It's not all gloom. Our price tags can also reflect some of the progressive actions that our countries have taken. For instance, India was one of the first countries to adapt global NCD priorities to its national context. Chile was the first country to implement front of package labeling. So we have made progress, but there's still a long way to go to not only regulate, but also to translate policy into action. And I feel like the best solution to overcome this paralysis is to partner with young people. Our messages as young people should not only just echo within our generation, but it should be intergenerational, kind of like the discussion that we're having today. Because together with an intergenerational approach, we can address the commercial determinants of health. We can change our country's price tags. And we can change our collective price tag as a planet together if we work in an intergenerational manner. So whenever we get the chance to reintroduce ourselves in the next few years, we can say that we have new price tags which reflect these new progressive actions. For instance, next time when I speak to you, I hope I can say, my price tag reads name Surabhi, manufactured in a country where air quality was 10 times worse than WHO standards, but has now moved the needle slowly but surely towards cleaner air.
I do hope for that future for us all, definitely. Now, I saw on LinkedIn the great reaction to the NCD price tag, and I just wondered in your conversations with other youth advocates at the forum, what kind of reaction were you getting from people, to your idea?
Thank you so much, Nicola. And I would have to say that your encouragement has been brilliant to actually hear that a lot of people have taken this as an important idea to talk about NCDs. When we usually talk about commercial determinants or NCDs, we may talk statistics, but it's always good to kind of try to present it in a different storytelling format. So I feel that from other young people, what I heard was that was a innovative way to kind of tell that story of adolescents and young people, not through just simple data points, but actually through personal experiences. And I think it's very important to be able to have a participatory method. And I hope that with the price tag also, it has a public link available. People can use that price tag to also advocate for change in their context. Reflect on, what your price tag looks like. Maybe mine, as I said, looks a major concern for me growing up in India is air pollution, one of the newest NCDs added to the list of non-communicable diseases. Maybe other people, other young people in other countries would have bigger concerns that are affecting their health and well-being. So I feel that community health workers can use the NCD price tag to reflect on what the status of health and well-being is in their community. How is commercial determinants of health shaping health of the people, the most marginalized in their community, and also reflect not only just a negative picture, but also have an ideal price tag of how things can shift, how we can maybe collectively to make sure that we are also introducing changes. So yes, a reflection of where we are currently, but also to use the NCD price tag to show that hopefully the cost doesn't have to be borne by the most marginalized in our community.
Fantastic. Stories are so powerful, and they're just as powerful to policymakers as they are to us in our communities. So, yes, fantastic. Well, I wonder whether you have any advice for the next generation of community health workers and advocates for fighting NCDs to give us a brighter future. Would you like to share anything with us?
That's a great question. I think a key ingredient to building healthy, fair, and climate smart communities and addressing the commercial determinants of health is intergenerational partnership. So, if I have to share advice, I'll share advice for both the new generation as well as experienced generation of community health workers. For the new generation of community health workers, I would say that our power is working at intersections. It's about breaking silos. It's about the willingness to talk each other's language and not just get stuck in these kind of brackets that are created conventionally. We are willing to challenge those stereotypes and those kind of boxes that define where or where we cannot work. So I think as young people, we bring that strength of multi-sectoral lens, using an interdisciplinary approach to address public health, because public health is not a monolith. Um, it requires multiple solutions from young people, and for us to apply the different sort of creative as well as logical minds to solve the solution, solve the problems that we see in our communities. And I think, like I said, we often, as young people, we ask for advice, but I would also give some advice to the experienced professionals. I think adolescents and young people need to be meaningfully engaged in co-creating a healthy and sustainable future. The climate crisis, it's not just our problem or something to be solved by the younger generation. We need to act together as a community. So intergenerational partnership, I feel, is key. We can't do this on our own. We need to act together.
Well, on the point of creativity, the NCD price tag gives us a fantastic example. And for visitors to the website and to the community health workshop, we will be making sure that a link where you can customize your own NCD price tag will be there there for you. Surabhi, it's been a pleasure to speak to you as always. And thank you so much for being with us today. I'm sure that our participants will really value this video. Thank you so much for your time.
Thank you so much, Tekla.